A 25-year-old male client presents to the emergency department complaining of severe headache, nausea, vomiting and knuckle rigidity. Nurse recognizes this patient may be experiencing some form of meningitis. Which test is the most appropriate to determine if this patient is experiencing the bacterial form of meningitis? A. Blood culture positive for Streptococcus pneumoniae. B. X-ray of the spine. C. Cerebral spinal fluid analysis showing elevated protein levels. D. Cerebral spinal fluid analysis to confirm elevated glucose levels. E. Computerized tomography scan of the head to assess for increased intracranial pressure. The answer is C. Cerebral spinal fluid analysis showing elevated protein levels. Cerebral spinal fluid analysis is the best test. Elevated protein, decreased glucose levels, with high levels of PMNs, polymorphonuclear cells, are indicative of bacterial meningitis, which is a medical emergency. Blood culture is appropriate but will not yield quick results. Computer tomography, CT, scan is also helpful but not priority. A patient is severely dehydrated and is being given IV normal saline at a rate of 160 cc per hour. Which of the following laboratory values would you expect to be abnormally elevated in this patient? A. Hemoglobin. B. Glucose. C. White blood count. D. Mast cell count. E. Creatinine. The answer is E. Creatinine. In a dehydrated patient, the BUN and creatinine is often elevated. Creatinine is a marker of kidney function. Elevations in creatinine from baseline are considered kidney injury. Dehydration is decreased circulatory volume to the kidneys. This will result in an elevation of creatinine and BUN on laboratory testing. Rehydration therapy with IV fluids will often correct this abnormality. What is the medical term for the artificial mechanism by which fluid and toxic solutes are removed from circulation when the kidneys are unable to function? A. Dialysis. B. BiPAP. C. Bronchoscopy. D. CPAP. The answer is A. Dialysis. Dialysis is an artificial mechanism used to filter the blood when the kidneys are unable to do so. The two major types are hemodialysis and peritoneal dialysis. Dialysis is usually considered in the treatment of chronic kidney disease and toxic overdoses. BiPAP and CPAP are used to help with respirations. Bronchoscopy is used to explore the lung space. The nurse is providing a teaching session to a client who has elevated uric acid levels. What type of diet will the nurse be teaching about? A. High potassium diet. B. Low purine diet. C. High calorie, high protein diet. D. High fiber diet. The answer is B. Low purine diet. Elevated uric acid levels is an indicator for a low purine diet. Other indicators include gout and kidney stones. The patient should restrict the diet to foods that are low in purine. A nurse wishes to reduce the symptoms of a client with systemic lupus erythematosus. The nurse should do all of the following except, A. Administer topical corticosteroids as prescribed. B. Instruct the client to use strong soaps to cleanse skin rashes. C. Administer a high iron diet and vitamin supplements. D. Instruct the client to avoid harsh sunlight and ultraviolet exposure. The answer is C. Administer a high iron diet and vitamin supplements. Certain diets can exacerbate systemic lupus erythematosus symptoms, including diets high in iron. Diet should not be high in calories, zinc, or fats. Compounds that may provide benefits include vitamin E, vitamin A, fish oils, selenium, and flaxseed. Which of the following is a possible complication of amniocentesis? A. Needle injury. B. Miscarriage. C. Rh sensitization. D. All of these. The answer is D. All of these. There are several risks to amniocentesis, including, but not limited to, miscarriage, infection, needle injury, and Rh sensitization. The rate of miscarriage due to amniocentesis is between 1 in 300 and 1 in 500. The other complications listed are relatively rare. Fundal height of a pregnant woman is measured from dash. A. The middle of the pubic bone to the bottom of the uterus. B. The top of the pubic bone to the middle of the uterus. C. The middle of the pubic bone to the top of the uterus. D. The top of the pubic bone to the top of the uterus. E. The bottom of the pubic bone to the top of the uterus. The answer is D. The top of the pubic bone to the top of the uterus. Fundal height, sometimes referred to as McDonald's rule, is measured in centimeters from the top of the pubic bone to the top of the uterus. The top of the uterus may also be called the fundus of the uterus. It is used to assess the growth and development of the fetus inside the womb. Alex is 17 weeks pregnant. She comes into the clinic to get an alpha-fetoprotein test. A low result could indicate all of the following except dash. A. The gestational age of the baby is incorrect. B. Preeclampsia. C. Fetal trisomy 18. D. Hydatidiform mole. E. Fetal trisomy 21. The answer is B. Preeclampsia. Alpha-fetoprotein is made by the fetus. Congenital abnormalities, fetal trisomy 18, fetal trisomy 21, are associated with low levels of this protein. Additionally, so is hydatidiform mole. Hydatidiform mole is the presence of an abnormal mass or growth inside the uterus. Based on a low result, the physician may want to conduct further testing. Preeclampsia is a dangerous medical condition characterized by high blood pressure. It is not associated with alpha-fetoprotein. The nurse is assessing a woman in labor. He knows that fetal bradycardia occurs when the heart rate drops below dash. A. 110 beats per minute. B. 120 beats per minute. C. 90 beats per minute. D. 100 beats per minute. E. 130 beats per minute. The answer is A. 110 beats per minute. Fetal bradycardia is recognized when fetal heart rate drops below 110 beats per minute for 10 minutes or longer. The normal fetal heart rate is between 120 beats per minute and 160 beats per minute. Fetal tachycardia is a heart rate above 160 beats per minute. Anne, a 32-year-old woman, presents for her first prenatal visit. The doctor orders a CBC, complete blood count. Which of the following is not included in a CBC? A. Blood type. B. Hematocrit. C. Hemoglobin. D. White blood cells. E. Platelets. The answer is A. Blood type. A separate test called a type and screen is needed to assess the blood type. Complete blood counts, CBCs, typically contain hemoglobin and hematocrit, platelet counts, white blood cell counts, and red blood cell counts among many other measures. They are among the most frequently ordered laboratory tests by providers. The physician will use this information to diagnose conditions such as anemia. The nurse is assessing fetal heart rate in a pregnant patient. The nurse records a pulse of 82 beats per minute. The nurse should dash. A. Ask the mother to lay on her right side. B. Call the physician immediately. C. Try another Doppler device. D. Add lubricant to the Doppler's surface. E. Move the Doppler device. The answer is E. Move the Doppler device. An 82 beat per minute reading could be the mother's heart rate, indicating that the nurse does not have the Doppler in the correct position. A normal fetal heart rate is between 120 and 160 beats per minute. The nurse must always remember to take the mother's pulse before assessing the fetal heart rate. Before calling the physician, it is important to determine that the data is accurate. To increase oxygen perfusion to the fetus, ask the mother to lay on her left side. Brittany is 40 weeks pregnant and calls because she is seeing pink-tinged discharge for the first time. The nurse should tell Brittany to dash. A. Continue to monitor. B. Call an ambulance. C. Lie on her back and place her feet in the air until help arrives. D. Drive to the hospital immediately. E. Eat a bland diet and continue regular exercise. The answer is A. Continue to monitor. This is most likely the normal bloody show at the beginning of labor. There is no need to immediately arrive at the hospital, change position, or eat a bland diet. The patient should continue to monitor and call back or seek care when she experiences regular contractions that are becoming more intense and frequent. Sarah is a 17-year-old female who has not gotten her first period and is visiting her doctor for an exam. She has displayed the normal growth and development of several secondary sex characteristics. The nurse would describe to the doctor that Sarah is showing signs of dash. A. Oligomenorrhea. B. Primary dysmenorrhea. C. Secondary amenorrhea. D. Secondary dysmenorrhea. E. Primary amenorrhea. The answer is E. Primary amenorrhea. Primary amenorrhea occurs when a female is 14 years old and has not gotten her first period and has not developed secondary sex characteristics. Primary amenorrhea also occurs when a female 16 or older has not gotten her first period but has developed secondary sex characteristics. Primary dysmenorrhea refers to painful menstruation not linked to a physiological disorder. Secondary dysmenorrhea refers to painful menstruation due to an underlying cause such as endometriosis. Oligomenorrhea refers to the absence of a period, typically for at least 35 days. Amber is a 39-year-old woman who is experiencing secondary dysmenorrhea. The nurse knows that Amber could be suffering from which of the following? A. Amenorrhea. B. Low levels of aldosterone. C. Endometriosis. D. Turner syndrome. E. High levels of prostaglandin. The answer is C. Endometriosis. Secondary dysmenorrhea refers to painful menstruation due to an underlying condition. Endometriosis, an example of a condition that frequently causes secondary dysmenorrhea, refers to the growth of uterine tissue in inappropriate places such as the ovary or rectum. High levels of prostaglandin are frequently found in women with primary dysmenorrhea, which is painful menstruation without an underlying condition. Low levels of aldosterone would not likely cause painful menstruation. Turner syndrome is a chromosomal disorder that can frequently cause amenorrhea, or absence of a period. A nurse is assessing an 18-year-old woman who has come into the emergency department for bilateral abdominal pain. Which of the following should the nurse not consider a risk factor for ectopic pregnancy? A. Neisseria gonorrhea. B. Yeast infection. C. Uterine fibroids. D. Chlamydia trachomatis. E. Endometriosis. The answer is B. Yeast infection. Uterine conditions such as endometriosis and uterine fibroids increase the risk of ectopic pregnancy. Endometriosis is the inappropriate growth of uterine tissue outside the uterus. Uterine fibroids are benign tumors within the uterus. Sexually transmitted infections can cause a condition called pelvic inflammatory disease, which can result in scarring. Scarring of the reproductive system greatly increases the risk of ectopic pregnancy and infertility. Yeast infections are common after antibiotic therapy and are treated with an over-the-counter medication. They generally do not cause permanent damage to the body. A woman who is 20 weeks pregnant calls the clinic because she is experiencing pink-tinged discharge for the first time. The nurse should advise the patient to dash. A. Decrease her activity level. B. Call back if the symptoms have not subsided in 24 hours. C. Call back if she experiences an increase in pelvic pressure. D. Seek medical attention immediately. E. Make an appointment to be seen tomorrow. The answer is D. Seek medical attention immediately. This woman could be experiencing preterm labor. A 20-week pregnancy is not considered viable. She should be seen immediately to determine if there is a cause such as cervical insufficiency, premature dilation of the cervix. Hannah is a 21-year-old woman who is presenting at the emergency room for severe vaginal bleeding. She is 32 weeks pregnant. Upon further examination, she is found to be suffering from abruptio placentae. Which of the following assessment findings would be of least concern to the nurse? A. Shortness of breath. B. Decreasing blood pressure. C. Bleeding from oral mucosa. D. Small red dots on the skin. E. A tender uterus. The answer is E. A tender uterus. Abruptio placentae is a serious condition where the placenta inappropriately and prematurely detaches from the uterus. Women with obstetric complications such as abruptio placentae can quickly develop disseminated intravascular coagulation, DIC. DIC is a clotting disorder in which the blood inappropriately clots. Severe bleeding can also occur as clotting proteins become scarce. Symptoms of DIC include blood clots, and bleeding into the tissues such as the skin and oral mucosa. A decreasing blood pressure is concerning due to the severe bleeding caused by the combination of DIC and abruptio placentae. Shortness of breath could indicate the presence of a blood clot. Although uterine tenderness is of concern, It is common with abruptio placentae and does not indicate an immediately life-threatening condition. The nurse completes a cervical exam on her laboring patient. She determines that her patient's cervix is 1 cm in length. How would the nurse describe this length? A. 50% effaced. B. 30% effaced. C. 100% effaced. D. 25% effaced. E. 25% effaced. The answer is A. 50% effaced. The normal cervical canal is 2 cm in length. Effacement is the thinning of the cervix as the body prepares for delivery. Thus, a 2 cm cervix is 0% effaced and a 0 cm cervix is 100% effaced. The nurse helps the healthcare team to deliver a healthy baby girl. Upon delivery of the placenta, the nurse notices that it is not 100% intact. What is the nurse's first concern? A. Infection. B. Deep vein thrombosis. C. Pulmonary embolism. D. Hemorrhage. E. Tissue perfusion. The answer is D. Hemorrhage. If the placenta is not whole upon delivery, a piece may still be present in the uterus. This inhibits the ability of the uterus to shrink in size and may cause hemorrhage. The missing piece needs to be located immediately. While monitoring a laboring patient, the nurse notices that the fetal heart rate at baseline varies from 110 to 145 beats per minute. The nurse's first action would be which of the following? A. Decrease IV fluids. B. Have the mother bear down. C. No action is required. D. Turn the mother on her left side. E. Administer oxygen at 1 liter per minute via nasal cannula. The answer is D. Turn the mother on her left side. Marked fetal heart rate baseline variability of 25 beats per minute or more may be cause for concern. Similar findings may indicate that there is poor oxygenation of the fetus. Turn the mother to her left side, to increase perfusion, and notify the physician. Note that this is still in the normal range for fetal heart rate for a laboring patient, about 130 beats per minute, and that the low end of the spectrum is of slightly more concern. Which of the following is not a risk factor for gestational diabetes? A. Asian ethnicity. B. High blood pressure. C. Prior birth of a child with a congenital disorder. D. Newborn weighing 9 pounds 2 ounces. E. Advanced maternal age. The answer is A. Asian ethnicity. Asian ethnicity is not considered a risk factor. Hispanic, Native American and African American ethnicities are considered risk factors for gestational diabetes. Others include maternal obesity, previous pregnancies with gestational diabetes, delivery of a very large baby, and a family history of diabetes. A woman arrives at the birthing center for evaluation. She thinks she may be in labor. She is multiparous and experiencing contractions every 3 minutes. Upon examination, the nurse notes that she is 5 centimeters dilated and 50% effaced. Which stage and phase of labor is the woman experiencing? A. Stage 1, Phase 1. B. Stage 1, Phase 2. C. Stage 2, Phase 2. D. Stage 1, Phase 3. E. Stage 2, Phase 1. The answer is B. Stage 1, Phase 2. The woman is experiencing the first stage labor in the second phase. The first stage of labor exists when the woman's cervix is dilating from 0 to 10 centimeters. The second phase of the first stage occurs during dilation from 4 to 7 centimeters and when the cervix is 40 to 80% effaced. The second stage of labor is when the cervix is dilated 10 centimeters until the delivery of the baby. The third stage of labor is the delivery of the placenta. The first phase of labor is the onset of labor until the cervix is dilated 3 centimeters. The third phase of labor is when the cervix fully dilates from 7 centimeters to 10 centimeters. The nurse is called to a room by a laboring patient. The patient complains of a backache and appears restless. Her fingers are trembling and beads of sweat fall from her forehead. The nurse suspects she might be experiencing which stage of labor? A. Stage 1, Phase 3. B. Stage 1, Phase 2. C. Stage 2, Phase 2. D. Stage 2, Phase 1. E. Stage 3, Phase 1. The answer is A. Stage 1, Phase 3. During the third phase of the first stage of labor, the cervix dilates from 8 to 10 centimeters and effacement reaches 80 to 100%. The woman will be less able to focus on other things and may require more support from support persons. Labor may progress quickly and the nurse should be preparing for the second stage of labor, in which the cervix is fully dilated at 10 centimeters. Andrea comes to the office for a prenatal visit. She mentions that lately she has been excessively hungry, thirsty, and very tired. Which of the following would the nurse suspect? A. Gestational diabetes. B. Toxoplasmosis. C. Anemia. D. Parvovirus B19. E. Preeclampsia. The answer is A. Gestational diabetes. Polyphagia, excessive hunger, polydipsia, excessive thirst, and polyuria, excessive urination, are 3 hallmark signs that point to diabetes. While increased fatigue is common in pregnancy, combined with the other 2 symptoms, it may be concerning. Preeclampsia involves elevated blood pressure, swelling of the hands and feet, and protein in the urine. Toxoplasmosis results from infection by a parasite and can affect fetal development. A amniocentesis is performed to diagnose the infection of the fetus. Depending on the suspected duration of infection and the gestational age, drugs may be administered to decrease the chance of the parasite from infecting the fetus. Anemia and parvovirus B19 are unlikely to cause all 3 of these symptoms occurring together. All of the following may trigger asthma in a pregnant woman except dash. A. Moist hair. B. Esophageal reflux. C. Stress. D. Animal dander. E. Unwashed sheets. The answer is A. Moist hair. All those listed may be asthma triggers with the exception of moist hair. Typically, cold air may trigger asthma exacerbation. Additional triggers include exercise, respiratory illness, smoke, and mold.